Sometimes getting normal test results is a relief, but sometimes it's the most frustrating thing ever, especially if you have unexplained symptoms that you don't know how to treat. Keep watching because in this video, I'll explain how normal lab results and optimal lab results are different and why it matters, because it actually matters a lot. In my experience, just because your standard blood labs are within normal limits doesn't mean that there's not a problem, and it certainly doesn't mean that you feel well. Maybe this scenario is familiar to you. You go to your doctor because something isn't right. You're having a hard time losing weight, you're constantly exhausted even though you're getting enough sleep, you're bloated all the time, you're moody, your hair's falling out, or your libido's in the toilet. Maybe all of the above. You describe your symptoms to your doctor, and they run some basic tests to get to the bottom of it. But guess what? All those tests come back normal. Now what are you supposed to do? Sometimes normal tests are fantastic news, but other times they're a dead end. Because if standard lab testing comes back within normal limits, it doesn't give us much to work with. It can put the brakes on further help or testing from conventional providers. And it can even lead to minimization or dismissal of your symptoms. It happens a lot. Here's where functional medicine takes a different approach. We don't settle for normal. When I'm working to determine the root cause of someone's health concerns, I want the most specific, helpful information possible. And that means seeking out optimal levels for each person in their unique circumstance. Let me explain. The first thing we need to remember is that average is not the same as normal when it comes to lab testing. Let's take vitamin D levels, for example. You might not be aware, but many of the original normal lab values were determined by population studies done on healthy white males. So, if you happen to be a female or non-white, you can imagine that these normal levels might not be your normal levels. And what does healthy mean in this setting? Who determined if the people whose levels they used to determine the reference range were healthy or not? What parameters of health did they use? Did they include mental and emotional health in their assessment? Sure, you might be able to survive on vitamin D levels of 23 nanograms per milliliter, but are you going to be energetic, happy, and full of life? Are those levels high enough to help you prevent chronic diseases like osteoporosis, cardiovascular disease, or dementia? I don't know about you, but a healthy level of vitamin D for me, as a female who lives far from the equator with a family history of seasonal affective disorder, is probably different than a healthy level for a 23-year-old man living in Costa Rica. Because I need more reserves, I have more complex hormones, and I have a predisposition to a mood disorder that's correlated to low vitamin D levels. That's why I need to optimize my vitamin D, not settle for something in the normal range. Makes sense, doesn't it? The point is that average doesn't mean normal for you, and it certainly doesn't mean optimal. What is an optimal range for vitamin D? I shoot for 50 to 90 nanograms per milliliter. But if you suffer from anxiety, depression, autoimmunity, or have a family history of dementia, I'd suggest staying in the upper part of that range. Thankfully, vitamin D is something that many conventional doctors are willing to test, but sometimes you need to ask for it to be added to your blood work. Because these optimal ranges can be tricky to determine, I've created a handy template with my optimal ranges for several micronutrients, like vitamin D, that you can download for free. I'll put a link in the video description for you. The second thing we need to be aware of when seeking the root cause of your health concerns is that insufficiency is possible without deficiency. In other words, you might have enough of a micronutrient or hormone to survive, but not to support the full optimal functioning of your body. Let's take vitamin C, for example. A vitamin C deficiency causes a condition called scurvy, symptoms of which include bleeding gums, bruising, deep pain, swelling, and poor wound healing. You can die from vitamin C deficiency In fact, many sailors did back before they brought fresh fruits and vegetables with them on long voyages. And while scurvy is very rare these days, just because you still have all your teeth doesn't mean that you don't have a vitamin C insufficiency. Vitamin C insufficiency means you've got enough vitamin C to avoid outright scurvy, but not enough to function optimally. You're not breaking out into a rash, but you're also not able to fight off infections very well. You may be fatigued and apathetic, since vitamin C is needed to produce neurotransmitters like dopamine and epinephrine, as well as carnitine for energy synthesis. You could have brittle fingernails and dry, damaged skin, since vitamin C is needed for collagen production. You might be more prone to fractured bones and anemia, too. There's a difference between normal and optimal when it comes to many lab tests, and unfortunately, most providers settle for normal in a lot of cases. This difference doesn't only apply to micronutrients either. One of the areas I see the most confusion has to do with hormones. Most of the women I talk to about hormones have been unable to convince their doctor to test them, even though they have serious symptoms. Even more have been told that their limited hormone blood work is normal and therefore useless when it comes to solving their concerns. This is especially common during perimenopause and menopause, when hormone fluctuations are often unruly and unpredictable. It's true that a random blood draw of, say, estradiol or progesterone has a normal limit that you could drive a bus through and limited diagnostic value on its own. But the reality is that timely, comprehensive hormone testing does help you figure out why your hormones seem to be messing everything up, not to mention rule out hormones as a root cause if that happens to be the case. And you can get your hands on many of these tests yourself, because hormones can be accurately measured in urine and saliva via simple at-home collection kits. The test I recommend the most is the Dutch Complete Hormone Test, because it not only tests the levels of hormones like estradiol, testosterone, and progesterone, it also tests cortisol, your chronic stress hormone, DHEA, and 2 other forms of estrogen, allowing us to see the complete picture of hormone function and relative balance. I can't tell you how many aha moments I've had with clients when we review these tests together and they finally realize that their hormones aren't normal after all. There's a lot of room between normal and optimal, and it's often a space of frustrating and confusing symptoms that are happening for no apparent reason. But really, that reason is staring you in the face. You just weren't aware of the insufficiency that's creating a functional or system-wide issue, which then creates symptoms. To get to the root of these issues, we need to do a few things. First of all, we have to actually test for insufficiencies. This is both harder and easier than it used to be. Harder because physicians have more limits placed on what they can order, when, and if insurance companies will pay for it. I know folks with very accommodating primary care providers who are happy to order labs like thyroid antibodies, vitamin B12, and RBC magnesium. But I also know folks who have to put up a fight anytime they want to see anything beyond a TSH and a CBC, even if they have active symptoms of suboptimal levels. Like I mentioned, I've noticed that this is particularly true with female hormones. Getting accurate, precise testing is also easier in a certain sense because of advances in the reliability of at-home testing kits, like the Dutch test, advanced functional testing availability, and increased access to self-ordering online. More and more people have HSAs and flex plans as part of their health insurance, allowing them to spend their healthcare dollars on this level of testing, which is great. But these labs aren't cheap, and it would be a huge help if insurance was more willing to cover micronutrient testing, comprehensive hormone testing, and other super helpful functional labs. Secondly, we have to stop accepting adequate when optimal is on the table. It's not rocket science. If you know that optimal levels of B12 are over 500, but your levels are only 192, it's a no-brainer to add a B12 supplement to your diet. If an optimal TSH is between 0.3 and 2.5, but yours is normal at 3.5, you need to dig a little deeper into your thyroid levels, right? Once you have the information and are able to assess it properly, you just need to do something about it. You would be appalled by how many people I've met who have obvious symptoms of micronutrient deficiency, who test barely in the normal range with labs, and yet their healthcare provider has done nothing to address it. Maybe that person is you. Finally, we have to take a whole person view, considering all the factors that could be contributing to the symptoms, instead of just the obvious surface level ones. It's how functional medicine is different from most conventional medicine. And it's why folks who embrace integrative diet and lifestyle-based strategies get such fabulous results. If you've had lab work done and you suspect that your levels aren't optimal, be sure to compare them to the free micronutrient chart that I made for you. You can download it using the link in the video description. If hormones are your concern, you're welcome to order your own functional testing, including the Dutch Complete, from my website. I'll even help you interpret it. I'll include some additional info in the description as well. I hope you found this information helpful and enlightening, and I hope it gives you some next steps to take in your own health and well-being journey. Thanks so much for watching. If you'd like to support my work and help other people access functional medicine resources, please like this video and subscribe to my channel. I'm super appreciative of your time. Oh, and don't forget to check out the video description for more resources and links. Thanks again, and I'll see you over in the next video.